All right. Hi, Dr. Emily. Thank you so much for being
Hi.
here. I'm so
Yes, of
excited.
course. Thanks for the
Yeah,
invite.
absolutely. For anyone who's watching, Dr. Emily and I have collaborated quite a bit with, my physical therapy clinic that I partner with, Comprehensive Therapy Services. My name is Dr. Rose. I'm an intimacy coach and pelvic floor physical therapist. So, Dr. Emily and I work really well together with pregnancy and postpartum. So, as you know, the muscles of the pelvic floor are involved in, supporting your core, and they definitely get a big workout during the pregnancy and delivery phase, right? Both leading up to your delivery and really like helping you feel back to your best self after delivery is all about what we do. So, Dr. Emily, I would love for you to just kind of talk about who you are, what you do,
Sure.
how you help postpartum and pregnant women.
Absolutely. Absolutely. So, as Dr. Rose mentioned, I'm Dr. Emily Hernandez. I'm a naturopathic doctor, and I own a practice in La Jolla called Wildcraft Medicine. And really, what we do is, as a naturopath, we are primary care physicians, and our goal really is focusing on the where symptoms are coming from, figuring out what's the root cause of those, and how do we treat the body as naturally as possible so it can heal itself. Because given the right tools and removing obstacles that prevent healing, the body really has this beautiful innate wisdom to heal. So, I love what I do. I kind of tell my patients I'm like a detective and kind of putting all the pieces together. And, sometimes people come in and they have 4 or 5 different types of symptoms that they may have been told are completely unrelated, but we talk about how those are most likely interconnected and related. And how do we, treat at the root so we can adjust all those things and get the body back into balance. And as Rose mentioned, one of our biggest passions here at Wildcraft Medicine is supporting women through preconception and fertility and supporting people and women postpartum. So we do a whole lot of things. We do gut health, we do hormone balancing. I have a handful of patients that came in this week for insomnia issues and energy. I have a background in treating chronic Lyme disease and mold, so some other kind of chronic hidden illnesses. But, if I had to pick anything out of the bunch, gut health, just because it's so interconnected to all aspects of health, and preconception, because it's just such a cool way to influence the health of not only the mom and make sure the pregnancy is healthy, but the health of that future baby. And I know we're going to dive into a lot of that today.
Yeah, it's kind of like, impacting the whole next generation, right?
Exactly. Yeah, it was kind of, when I was after medical school and figuring out, what route I wanted to go, what do I want to focus on, I was like, how can I really impact society and health, at the biggest, in the biggest way? And to me, it was, preconception, because health really does start before we even conceive, the health of the egg and the health of the sperm, not only physically those aspects, but also the like general health of the mother and the father, mental,
Mhm.
emotional health and whatnot, really impact and play a role in how healthy that baby is when they're born, but also their health throughout life.
Yeah.
So really, really cool. I'm passionate about it. I've always wanted to be a mom myself. I'm not quite a mom yet, but I'm actually on that preconception journey
Yeah.
myself. So it's been really cool to kind of practice what I preach,
Mhm.
get my body ready to bring, new life into the world.
Yeah, that's amazing. And
Yeah,
something that I really value and love about the way you practice is really honoring the body's inner wisdom and taking a look at like,
absolutely.
when something is going wrong in the body, it's not like your body is betraying you for no reason.
Right.
It's these
Right.
signs, and it's an invitation to just get quiet and look a little
Yes,
deeper,
exactly.
figure out like what that root cause is, and
Right.
by addressing that root cause, all the other sequela, like all the other things that are going
Hmm.
on, resolve. And so often I know gut health is
Yeah.
like the biggest thing,
Oh,
but
yes. Yes. Yeah.
um
And it's funny when you go to just, in our traditional medical system and you go for some sort of symptom, they're treating that symptom, right?
mhm,
That's the problem. What I like to tell patients is your symptoms are just a way of our body communicating that something's out of balance. And our job as the doctor really is to figure out behind that symptom, what's going on. So yeah.
yeah,
And as you said, so much of it is connected to the gut. Um, again, one of my other favorite passions, and the gut is related to metabolism and mood and energy, as well as, sleep and our cycles, So just really amazing to kind of see how everything's interconnected.
Yeah, that is amazing. And I'm just so aligned with how you practice. And,
Thank
because
you.
the pelvic floor houses, your bladder, your uterus, if you have one, and your rectum all super close together, it's like many of the clients who come in to work with us feel like they don't have any gut issues because, nothing is happening from a digestive perspective, but it's like they have urinary issues, or, there's pain during sex, and there's other things coming
Right.
up. And it's like, it's all connected because everything is so close together. And then obviously your gut is kind of like your second brain and your like second immune system, right?
Absolutely.
So
Sorry, I'm trying to, I actually just got kicked out. I can't see anything. So I'm just trying to get back to my view here. I
oh
apologize.
yeah, no
That's why
problem.
I'm a little bit distracted. I don't know what happened. Uh, there we go. Okay, sorry. I think a phone call came through and it like knocked me off.
Oh, that happens to me all the time. I hate that. Or it'll kick
Yeah.
my like Bluetooth headphones out and then I
Yes.
can't hear my
Yes.
person. So
Yes, exactly. Okay, I'm
it's
back.
post-COVID problems, right? Like
Oh my gosh, I know. Yes, absolutely. Absolutely.
So if you feel called to share, I would love to hear a little bit more about, some of the things that you do to help prepare people who want to get pregnant for that fertility journey, for that pregnancy, because I know that a lot of the people I work with are either working on painful sex and working on that journey to conceive, or
Hmm.
they're postpartum and we're helping them rehabilitate postpartum, and so they're kind of building back up to conceive again. So
Right.
I'd love to hear from your perspective some of the things that you do with those people.
Absolutely, absolutely. So when I think about preconception kind of time frame, I'm thinking at least 4 months. The reason being is that it takes about 4 months for the egg and sperm to fully develop. So
Mhm.
if we take 4 months to kind of prep the body and give it all the nutrients and the building blocks it needs, then we can make sure that that sperm and that egg is as healthy as possible. So I really, it's not something you hear very often because most people are like, okay, I want to get pregnant. They come off their birth control and they just get going and they start trying. But really, those 4 months are so critical for
Mhm.
making sure the pregnancy is healthy, the baby's healthy. So, in that time period, what I typically suggest we do, I kind of think of it as three major phases. So, the first phase is just getting general information about your health.
Mhm.
And addressing any pre-existing conditions you have. So we run a bunch of blood work, maybe we'll do stool testing or saliva testing, depending upon what you have going on. And we want to make sure we're addressing hormonal imbalances, thyroid, gut health,
Mhm.
insomnia, stress issues, because all of those things are going to impact a healthy pregnancy and your ability to, create a healthy baby. So that's first and foremost. Now, in a perfect world, that's about a month, but sometimes it takes longer, right? I mean, it took you however many years to kind of get out of balance. So people have to
Sure.
remember this isn't necessarily a quick fix,
Mhm.
but the idea is to fix it at a level where the body is now back on track. It's back on balance, and it can do and run things optimally on its own. So that time frame can kind of fluctuate depending on what people have going on. And then after we're kind of, getting on track with fixing anything that's already there, the next stage in my mind is detoxification. So,
Mm.
and this to me is so, so key. Even if you feel like you're generally healthy and you don't have anything really to address ahead of time, detox is so, so key because, unfortunately, especially with the first child that we have, we end up dumping a lot of our toxins that our body's holding onto
Mm.
our first child. We're sharing
Mm.
that bloodstream, we're giving them nutrients, and unfortunately, along with that, they get some of the bad stuff too. And it's hard to understand, again, like I live a really healthy lifestyle, as much as we can. We eat organic, we try to use clean products in the house, like not a lot of, perfumes and
Mhm.
chemicals and all that. But unfortunately, just living in this world, we are exposed to different toxins through food, through the
Mhm.
environment. We live close to a city, there's the airplanes, there's the cars, and so forth. So naturally, our bodies, our cells, the fat tissue that we have is going to hold on to some of those toxins. And so, really, if you have the ability to give yourself some time and detoxify those toxins like heavy metals, different environmental toxins, the parabens, the BPAs, things like that, volatile oils, as well as even things like mycotoxins that come from mold. This can just be people will be like, wow, I always felt fine, but now all of a sudden, like, I'm feeling optimal. I didn't realize there was that huge jump. And you're going to set up a much healthier pregnancy and baby. So that is number 2 and super important. That's actually what I'm currently working on myself. That's been kind of a fun journey. And then part 3 is, okay, now that we've gotten everything into balance, we've detoxed the body, now let's kind of give the body the nutrients for fertility. Make sure we're taking things that are going to support healthy eggs, healthy sperm, keep the hormones balanced, so that we can optimize fertility and conception. So that's kind of the 3 major phases of how we help patients here. Yeah. And it's slightly different for every person because we do like to individualize what we're doing, but that's kind of what it looks like.
That's awesome. And I love that what you just said is like, wow, I didn't even really realize that I didn't feel optimal until I felt optimal. And I think that that's such a beautiful part about naturopathic medicine. It's like, you don't have to wait until something is wrong or like something is screaming, right? So sometimes I talk about messages from your body, like, sometimes your body will whisper and then they'll get a little louder and get a little louder. And then it's like screaming to have you look at this one part that's not working. And so I feel like in naturopathic medicine, you can kind of catch those signs from your body before they get to that volume of like, oh my gosh, I'm completely laid out. Right.
And if you can catch it before that, it's most of the time much easier and faster to treat. Once you're in that screaming point, then it's like, okay, well, now we have to somehow try to get ahead of it. And that can be, that can take some time. That can be a little tricky, but it's still doable. But it does take a lot of, lifestyle changes. It's not just about kind of whether it's a supplement or a medication. It's not just about popping a pill. We definitely use supplements and herbs, and definitely tends to be received a little bit better in the body and less side effects. But the lifestyle is probably number 1, between the diet and the exercise and the movement and the sleep and the rest and the stress. I mean, I would say that is, for anyone out there listening, that's like, how can I get started? It's that kind of stuff that's going to help you kind of get through this journey more smoothly, more quickly. If you already kind of come to us and you're, and obviously you're not going to have all the answers, and that's what we're here for, to guide you on all that. But if you can start cleaning up your diet, and, I think people, when they reflect, they know when they eat that, that cookie or that sandwich or whatever, that, delicious nachos with cheese, they don't feel as good, even though they love it and they feel good in the moment. You can kind of, if you listen, if you're actually actively listening, your body will tell you, what's sitting well with you and what's not. And some people need a little bit more guidance because they're like, oh, I've taken all that stuff out and I still feel crummy. So we can definitely still work on, that's where we really can help out. But if we can start to get that lifestyle kind of things on track, then, it's going to be much more smooth sailing for sure.
Absolutely. And I think that's something that we talk about a lot in our clinic. If somebody comes to us with, pain or other issues, and we have to treat the whole person. We have to look at what other areas of your life are impacting your healing, because you are a whole person. You're not just, your pelvis, your gut, your heart, right? And I think that our medical system is so often set up like this, interconnected lily pad system where it's okay, I go to the gynecologist and she, looks at, my pelvis, and then I like lily pad over here to, another provider, like an endocrinologist who looks at my hormones.
And all those practitioners are like so needed, like having that really honed in focus is so, you need that for sure. But we also need people that are going to be able to take a step back and look at the whole forest.
Yes.
And be able to connect all those trees or those lily pads, that's so key.
Right. So Dr. Emily, do you have anything coming up where people can learn a little bit more about this?
Yeah, absolutely. So as I said, preconception is definitely one of our, passions here at Wildcraft Medicine. And we actually are offering a free webinar for any mamas to be, or even if you're not like actively thinking about trying, but maybe, in the next, 3, 4, 5 years that having kids is one of your goals. There's going to be some really great information. So myself and my other naturopath that works for me, Dr. Caitlin Cloyd, will be kind of having a conversation like this and talk a little bit more in more depth about preconception, why it's important. We're going to dive into, I think there's still that mystery around how women's hormones fluctuate and cycle through our cycle. So we're going to actually dive into that a little bit so you can understand more about how the hormones are working, when ovulation's happening, how to track it, and then some of the specific testing that we offer, and our general approach as well. So that's coming up March 24th.
Awesome.
It's at 5:30 p.m. Pacific Standard Time. And we're going to do that live. It'll be, I think we're going to be doing it through Instagram.
Okay.
But if you go to any of our website, our Instagram, Facebook, we are starting to advertise it now. So you can submit your email so you can get the link to that.
Awesome. And then for anyone out here listening who maybe can't make it to that webinar or just wants to get in touch with you, like what's the next step? How do they reach out to you?
Yeah, so probably the way most of our patients connect with us is through a free 15-minute consult. And this is a really great way to connect on a one-on-one basis. We get to hear a little bit about you, learn your story, what you have been dealing with, struggling with it, and so forth. And then we give you a sense of like our approach, how we'd help you as a individual person. And then from there, we can kind of move forward if it seems like a good fit on both sides. So I'd say setting up a free 15-minute consult is probably the best way to get started. And you can do that by going to our website. Everything really, it's pretty simple, is Wildcraft Medicine. So it's wildcraftmedicine.com. Our Instagram, we're pretty active on that, is just at Wildcraft Medicine. You can also call our office. It's, we can put it in the comments or whatever, but that's on our website as well.
Awesome. And we'll make sure to share this with the video as well, so people can see how that's spelled, because it's wild, W-I-L-D, and then craft, C-R-A-F-T.
And it is one word, but when you're doing it through Instagram and website anyway, it's kind of all one word. So Wildcraft Medicine for everything. But yeah, that's the best way. It's kind of nice too, because then you get a sense of hearing how we would support you on an individual level. So
I think it's so helpful to kind of take that general information. Maybe someone has looked into your website and seen like, wow, there's all these different things you can help me with, but it's kind of hard to see that personalized roadmap of how someone would work with you. And I'm so excited because I already have a couple mamas in mind who are just finishing up their time at comprehensive therapy and really looking to rebuild and refresh. So
and I think we talked briefly but not too much about postpartum, which is also hugely kind of important. And I think often there's so much fuss about the new baby, obviously, that the moms that have just gone through this honestly traumatic experience, even though it's beautiful and wonderful, but traumatic to the body, they need some extra support and help. So, that's where we can also be really helpful. You're giving a lot of nutrients throughout the pregnancy to the baby. We need to, at that point, build you back up. We can run, labs to look at your hormones, make sure everything's normal. But this is where we really work well together, Dr. Rose and I. She's working on that, structural piece. We're working on kind of the biochemistry piece. So, that's really important, especially if you want more kids, whether you're just starting a family their first time or you're about to have kids again for the second time, third time, whatever, building back up your body. And then the preconception stuff I talked about before is just as important, because as people have more kids, their nutrient levels do tend to go down. And so now the kids, we always, we joke in this kind of line of practice that the first child typically is kind of toxic, oftentimes, if you're not doing the right things. And obviously people have kids without doing this and they're totally fine, but they have more of a toxic burden, right? Where the second, third child tends to be nutrient deficient. So we want to prevent all of those things. And so working with mom, working with dad to kind of help bring that nutrients back up postpartum, help you heal better and help you get your body get ready for the next child, if that's what your plan is also really important.
Yeah. And it's so interesting to think about, even your birth order, right? So like, I'm thinking about myself and my younger brother, like I'm the toxic one. And then he, he came next. So it's like, if I were to come to you and say like, hey, I'm a firstborn in my family, you can kind of use that information of preconception knowledge to say, okay, your toxic burden is probably a little bit higher because you
Yep.
were the firstborn, right? And like back in
Yeah.
the day. So
Yeah. 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 And you know, and I like to preface that like none of this is about shame. Like for women that didn't know about this or they've already had kids and they're like hearing about this for the first time, you know, obviously you have like beautiful children and they're great and there's nothing wrong with not doing these things too. But our point with kind of talking about this is empowering people, helping support hopefully healthier societies moving forward. So we don't have as much of these like lifestyle chronic illnesses that we're dealing with later down the road.
Mhm.
So, you know, again, I like to always point that out because I think sometimes moms, you know, listen to stuff like this and like, oh my gosh, like I didn't do this with my first child and now I feel guilty. Like, no, 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 no. We're not trying to put guilt on anyone or shame anyone. But if you are going to have more kids, you know, let's kind of help you get to that point where we can start things out a little bit healthier. So,
Yeah, Dr. Emily, I
um,
love that distinction that you just
yeah,
made because I think that
yeah,
there
I think it's
is so
important.
much parent guilt and parent shame, and
Hmm.
truly like any area of life, but especially parenthood. You
Yeah,
can only do the best with the information you have at hand.
exactly.
And you know how much you care about your baby. You know you did the
Hmm.
very best with the
Yep.
information that you had. There was nothing more you could have done at that time.
Right.
And I
Right.
think it's also important, we as pelvic floor physical therapists talk about, once postpartum, always postpartum. There's never too late to address these issues. I think
Love
that
that.
with you, same thing, right?
Oh
It's
yeah.
never too late to address this. And so don't
No.
feel like you missed the boat or,
Right.
like, oh, well, I didn't do it during the preconception, so there's no point, right? So we can still
Right.
come in and
Yes.
support you.
Yeah. I have women, you know, postpartum, but maybe they had kids 5, 10 years ago, but they're still dealing with nutritional deficiencies or hormonal imbalances, or their metabolism has never been the same. So, you know, that's a very common that we see patients like that and definitely can help them, you know, get their metabolism and their system back on track. So, great
Yeah.
point.
Well,
Yeah.
I'm just so happy that you spent your morning with me, that you
Oh,
shared some
so
of your
fun.
information. I think everyone who is at comprehensive therapy services, my coworkers and our patients, I think are really going to find this very valuable. And
Great.
definitely to anyone watching, please reach out to Emily. She's amazing. So
Thank you. Thank you.
thank you so
Yes, and
much
we'll
for your
we'll
time.
be having some more. We've got that webinar, and we're going to be having some more guest speakers on this topic, and like, you know, how to look at your home and figure out like what cleaning products and beauty products, you know, maybe you should be replacing, and
Mhm.
you know, all different sorts of kind of fun interviews and stuff. So definitely join us on Instagram if you like this kind of information, and we'll be continuing to share. I've actually been sharing my preconception journey, like showing my labs and what I've been doing for detox. So if you want to follow along, please feel free to follow us.
Oh, that's so amazing. And I think it's such a gift, Dr. Emily, to, let other people in on this intimate journey that you're going through. And I think it shows, there are ups and downs in fertility. There are many
Absolutely.
different choices that we have to make. And a lot of the time, the vision that we have of what that preconception period will look like doesn't match the reality. And if that
Hmm.
happens, it's okay. It's normal. That's
Exactly.
life. And I
Yep.
think you've done a really beautiful way of, just demonstrating how you can kind of like let go, but still stay true to your values. So I'm,
And that's a constant, you know, I'm human too. It's a constant reminder, you know, like since we're in this world, it's like, okay, this is exactly how it's going to happen. But, you know, you get some things thrown at you, some obstacles here and there. And yeah, it's about going with the flow, keeping an open mind and having faith that things are going to kind of work out the way they're supposed to, with controlling what you can control and letting go of what you know, maybe can't control. So yeah, thank you. I appreciate that.
yeah, absolutely. Well, thank you
Yeah.
so much for your time,
You're
for this
welcome.
awesome, valuable information. And
Anytime.
I can't wait to talk again soon.
Sounds good. Thank you so much for having me.
You're so welcome. Bye.
Take care. Bye.